Hi guys, thank you for attending our today's tutorial. If it is your first time, kindly subscribe to our channel for more information. Now today we shall talk about pharmacokinetic. Now pharmacokinetic is a branch of pharmacology. So it is the study of how the body interacts with the administered substances for the entire duration of exposure. Generally, pharmacokinetic in simple terms is what the body does to the drug. Now for us to understand pharmacokinetic, we have four parameters we have to examine. That is, from the time the drug is ingested to the time it is eliminated outside the body. So these parameters are the absorption, distribution, metabolism, and excretion. Now the first parameter is absorption. So absorption is the process in which dissolved drug pass through epithelium tissue. It occurs at different sites of the tissue depending on the mode of administration of the drug. So drug can be administered in the body through main four routes, that is enteral, parenteral, transdermal, and respiratory. In enteral, we have the buccal, we have the sublingual, oral, and rectal. In parenteral, we have subcutaneous, intradermal injection, we have intravenous injection, and even intramuscular injection. Now in topical, we have the painting or swabbing, we have irrigation or douching, we have in epidemic and epidemic, we have insufflation and instillation. Now in elation process, we have various process like vaporization. We have another process like gas inhalation. We also have a process like nebulization. Now these are all the processes, the routes in which drugs can be administered in the body. Now, there are very many factors that affect drug absorption. Now, the major or the first one is the pH. So, most drugs are weak electrolyte. That is, the ionization is pH dependent. So, ionization being lipid insoluble, we do not include. And the pH difference across membrane can cause differential absorption of weak acidic and weak basic drugs from the two sides. Acidic drugs like aspirin with a pKa of 3.5 are largely ionized at acidic pH and are absorbed from the stomach. Basic drugs like atropine with a pKa of 10 are largely ionized and are absorbed in the stomach, in the intestine. So therefore, to increase absorption of the weak acid drug, it should be put in acidic environment. Okay, increasing pH increases the absorption of basic drugs. Decreasing pH increases absorption of acidic drug. So another factor that majorly affects the absorption is the blood flow. So blood circulation removes drug from the site of absorption, therefore maintaining the concentration gradient across the absorbing surfaces, hence increasing drug absorption. So decreasing blood flow decreases absorption of the drug. Absorption of the drug is highly in organs with high blood flow like kidney, as compared to organs like skin with low blood flow. So if you decrease blood flow, it will decrease absorption. If we increase blood flow, we increase absorption. Another factor is the contact time. So contact time is the time taken by the drug at the site of absorption. Now increasing mobility of the drug increases the contact time, hence reducing absorption. For instance, in a condition like diarrhea increases the mobility of the drug, hence reducing the contact time, leading to poor absorption. In some conditions like constipation, the movement of drug is decreased, hence increasing contact time. which lead to increased absorption. So the longer the time a drug takes at the site of absorption, the higher the absorption process. Now, decreasing the time taken by the drug at the site of absorption will decrease what? The absorption of the process. The absorption process, sorry for that. Now, another factor which is very important, is the surface area. Absorption of the drug mostly occur in the villi. The villi are tiny hair-like projections lying inside of the small intestine. Now, these villi contain blood vessels that help in increasing absorption. So, diseases that destroy this villi decreases the surface area of absorption, hence decreasing absorption. The greater the surface area, the higher the rate of absorption. The larger the surface area of absorption site, the higher the absorption. Now, the last factor I want to talk about is the particle size. Now, particle size, I think generally we understand by what particle size. So, the lipid insoluble drug crosses biological membrane by filtration. This can only occur when the particle of the drug is smaller than the diameter of the pores. The small drugs particle pass through those pores very easily, hence increasing absorption. So, after now, another thing we have to discuss is bioavailability. Can't just pass without mentioning bioavailability, especially where we have discussed absorption. So, what is bioavailability? Bioavailability is the fraction of the drug that reaches the systemic circulation. Generally, when a drug is given intravenously, its bioavailability is 100%. But when given to other mode of administration, there's a fraction of the drug that reaches the systemic administration. So that fraction of the drug is what we call the bioavailability. Okay? When a medication is administered via any route other than intravenous, its bioavailability is generally lower than that of intravenous due to intestinal endothelium absorption and fast pass metabolism. So how is this bioavailability? Has some factors that affect. So what are these factors? Factors that affect bioavailability are like solubility, instability, and fast pass effect. Ionization reduces solubility of the drug. An ionized drug are easily soluble in lipid-based, hence increasing bioavailability. Okay. In instability, we can say drugs like, for instance, drugs like penicillin, when we give them orally, the acid will destroy it, hence reducing bioavailability. So insulin can also be destroyed by pancreas enzyme if given orally, hence reducing bioavailability. So these two drugs are very unstable and therefore we cannot give them orally. If we give them orally, we will reduce what? The bioavailability, and that is why we prefer the parenteral. Another factor is the fast pass metabolism. So when we give drug through oral administration, it must undergo fast pass metabolism, hence reducing the bioavailability. Okay, it's just that simple. Now, another factor we can just highlight is the disintegrating factor. Okay, if the drug is not easily disintegrate, then it will not pass through the small pores. So that will also reduce the bioavailability of such drug. Okay. Thank you for watching our YouTube today. Kindly subscribe for more YouTube channel and for more support. Thank you guys, and let's meet next time.